Hello, today I will be talking about the Unified Code for Units of Measurement, or UCUM. Initiated by the Health Level 7 International Organization, UCUM's development brought together experts from diverse fields such as healthcare, metrology, and informatics. This collaborative effort, involving stakeholders from organizations such as HL7, the National Institute of Standards and Technology, and others, ensured UCUM's broad applicability and relevance beyond healthcare. Through iterative releases and refinements, UCUM evolved into a formal standard endorsed by HL7, ANSI, ISO, and other standards bodies. Its adoption as a universal code for units of measure cemented its place as a cornerstone of interoperability and consistency in healthcare and scientific data management. UCUM's ongoing development reflects a commitment to adaptability and responsiveness to evolving needs, maintaining its status as a vital tool for representing units of measure in an increasingly interconnected world of data. Historically, there have been challenges in the standardization of units of measure across different industries or countries. Due to the lack of consistency and interoperability in the encoding and exchanging process, there were inefficiencies in data communication. Therefore, the UCUM emerged in the early 2000s to establish a universal code for units of measure within the healthcare and scientific communities. Healthcare, in particular, required a standardized approach to units of measure to ensure accurate and meaningful interpretation of clinical data, facilitate seamless communication between healthcare systems and providers, and support interoperability across various health IT systems and devices. By establishing a universal code for units of measure, the UCUM aimed to provide a common language that could be universally understood and implemented, promoting consistency, accuracy, and interoperability in the representation and exchange of quantitative data across different industries and applications. The development of the Unified Code for Units of Measure, or UCUM, involved collaboration among various organizations and stakeholders from different domains, including healthcare, metrology, and standards development. Key participants included Health Level 7 International, a global authority on healthcare interoperability standards, which initiated and coordinated UCUM's development. The National Institute of Standards and Technology, or NIST, also provided expertise in metrology and measurement science, thereby ensuring the accuracy and precision of UCUM's representations. Additionally, the American National Standards Institute and the International Organization for Standardization also played roles in endorsing and promoting UCUM as a standardized approach to representing units of measure, both nationally and internationally. Alongside these organizations, other standards development bodies and industry consortia contributed to UCUM's development, ensuring that the standards met the diverse needs of industries and domains. This collaborative effort led to the establishment of UCUM as a universally accepted and standardized method for representing units of measure, promoting interoperability, consistency, and accuracy in data exchange and communication across various sectors. The development of the UCUM followed a collaborative and iterative process guided by principles of consensus building and stakeholder management. Working groups, often formed by organizations such as HL7, comprised experts from relevant fields who drafted proposals and specifications for the UCUM, which were informed by research into existing coding systems and measurement standards. Draft versions were circulated for review among stakeholders, including healthcare professionals, measurement scientists, and software developers, allowing for feedback and refinement. Through discussions, debates, and negotiations, consensus was reached on key aspects, such as syntax and semantics. Stakeholders engaged in validation and testing exercises to identify and address any issues before formal adoption. Effective communication and inclusivity were crucial throughout, ensuring that the UCUM met the diverse needs of its stakeholders and provided a standardized approach to representing units of measure across industries and domains. The implementation of the UCUM has profoundly impacted various industries, particularly healthcare and science, by enabling interoperability, standardization, and improved data exchange. the UCUM is widely integrated into healthcare information systems such as electronic health records and laboratory information systems, which ensure consistent representation of measurements and observations across different platforms. It also facilitates health information exchange initiatives by standardizing the representation of units of measure, enabling seamless data exchange between healthcare providers, laboratories, and public health agencies. Moreover, the UCUM is employed in medical devices and sensor technologies, enabling compatibility with healthcare systems and facilitating the integration of device-generated data into clinical workflows. In clinical research and analytics, the UCUM supports the aggregation and analysis of quantitative data and enhancing evidence-based decision-making and healthcare quality improvement efforts. Integrated into healthcare standards and terminologies, such as HL7, FHIR, LOINC, and SNOMEDCT, UCUM ensures consistency and interoperability in data exchange, driving enhancements in patient care, medical research, and healthcare delivery efficiency. While the UCUM has become a widely adopted standard for representing units of measure in various industries, including healthcare and science, it does have some notable weaknesses and implementation challenges. First, its complexity. UCUM syntax and semantics can be complex, especially for non-experts. The standard employs a hierarchical structure to represent units and their relationships, which may require specialized knowledge to understand and implement correctly. This complexity can pose challenges for developers and users unfamiliar with its intricacies, potentially leading to errors in data representation and interpretation. While the UCUM includes a comprehensive set of units for most common measurements, there may be gaps or limitations in its coverage, particularly for specialized or domain-specific units. Users may encounter situations where UCUM does not adequately represent certain units or requires extensions to accommodate specific measurement needs. Addressing these gaps may require additional effort and coordination among stakeholders. Despite its widespread recognition and endorsement by standards organizations, the UCUM may not be universally adopted or implemented in all systems and applications. Some organizations may continue to use proprietary or legacy coding systems for representing units of measure, leading to interoperability issues and data fragmentation. Encouraging broader adoption of UCUM across industries and domains remains a challenge. Implementing the UCUM within existing systems and workflows can also be challenging, particularly for organizations with legacy infrastructure or proprietary data formats. Integrating the UCUM into software applications, databases, and medical devices may require significant development effort and resources, including updates to existing codebases and data migration processes. Additionally, ensuring data consistency and accuracy during the transition to UCUM encoded representations may present implementation hurdles for many organizations. Finally, the UCUM requires regular maintenance and updates to address evolving measurement needs, incorporate new units, and ensure compatibility with emerging technologies and standards. However, managing these updates and ensuring backward compatibility with existing implementations can be a complex task for standards organizations and stakeholders. Without proper governance and maintenance processes in place, UCUM's relevance and effectiveness may diminish over time. These are some examples for the complexity of the data standards, which can make it hard for non-experts to understand. This can create a barrier for the usage of the UCUM. Here, the first table represents proposed base systems that were tuned toward communications of units and computation with units, while the second matrix represents a transformation between two different systems. Ongoing maintenance and future directions for the UCUM involve several key aspects aimed at ensuring the standard remains relevant and effective. This includes regular updates and maintenance to address emerging measurement requirements and technological advancements. Effective governance and coordination mechanisms are essential for managing UCUM's evolution, involving communities and working groups to oversee development and ensure consistency. Community engagement is crucial for gathering feedback and driving consensus on proposed changes. Future directions may involve expanding UCUM's coverage to include additional units and providing enhanced documentation and guidance to support broader adoption. Integration with emergent technologies and alignment with international standards are also important considerations to promote interoperability and global harmonization. Overall, a collaborative and proactive approach is necessary to ensure that the UCUM continues to meet the diverse needs of stakeholders and support interoperability in representing units of measure across industries and applications. Thank you.